All right, let's go down to Atlanta, Georgia now, where CDC Director Rochelle Walensky just announced a massive reorganization at the Centers for Disease Control.
Yeah, the announcement comes after 2+ years of criticism over its handling of mixed messaging throughout the COVID-19 pandemic. Joining us now with more insight is the former acting director of the CDC, Dr. Richard Besser. Dr. Besser, great to see you.
Great to be here. Thank you.
Dr. Besser, great having you on this morning, especially after that big news. The New York Times writing a big article yesterday about how the CDC does plan to reinvent itself. They said, quote, for 75 years, the CDC and public health have been preparing for COVID-19, and in our big moment, our performance did not reliably meet expectations. You used to run the CDC. What's your take on what Dr. Rochelle Walensky is trying to do?
You know, Rob, I think what she is laying out for the CDC will make CDC a stronger health agency. Will make it the kind of public health agency that we as a nation need and want. Whether she's able to accomplish what she lays out is another question. You know, one of the big things that she points to is the critical need for CDC to think differently about how it interacts with the public, how it shares information. It is a science-based health agency, and a lot of the communications that come out are directed towards health professionals, towards public health professionals, towards medical professionals. But one of the most critical functions of CDC during a crisis is to talk directly to the American people, to let people know what is going on, what they're doing to try and help keep people safe, and most importantly, what individuals can do on their own to try and protect their health. That kind of conversation, that direct engagement with the public is absolutely essential for building trust and maintaining trust during a long health crisis.
Yeah, I think you're so right about that, Dr. Besser, is the trust, because Americans during COVID-19 turned to the CDC and we took everything they said, word for word, especially in the beginning, because we trusted them. They lost that trust over the last 2+ years. You served as acting director during the H1N1 pandemic and 4 years as head of emergency preparedness and response. So I want to get your thoughts on how the CDC handled COVID-19 pandemic looking back.
Well, yeah, there clearly were a lot of missteps. There were a lot of challenges. Early on in the pandemic, CDC wasn't given the microphone, and it was clear that a lot of decisions were not being based on public health science. But as the pandemic continued, we continued to see challenges with getting clear information that the public could use in a timely manner. One of the principles of risk communication is be first, be right, and be credible. And on each of those measures, CDC did not live up to what it could be, and what I hope in the future it will be. Part of this will come down to whether Congress makes some of the changes that are needed. I don't think most people recognize that CDC cannot require states to send any information in. And during a public health crisis,
that's
you need
interesting.
to know what's going on. Yeah, it's
really
not one of the authorities that's given. And during a crisis, during COVID, a lot of the best health information was not coming from CDC in terms of the number of case counts. It was coming from other organizations, because CDC could not say to a state, you have to report to us, every day or once a week, how many people have COVID, how many people are in the hospital, so we can track this and help make decisions in terms of who needs more resources, who needs more help.
Dr. Besser,
that would require a change from Congress.
We've talked so many times. I appreciate you saying that. I think that is the truth. I think that's so honest. I think people at home are probably nodding their heads saying, yeah. And I think, to me, when I saw this yesterday, this is a mea culpa. This is an apology from the CDC, acknowledging the mistakes of the last 2 years. And by the way, nobody's perfect. No organization is perfect, the CDC included. But I think we need to hear some of this from people like Dr. Fauci, people that were, front and center throughout the pandemic, who misled a lot of people. When the next, and we're dealing with this with monkeypox right now on a small scale, but when the next pandemic comes, whether it's in 10 years or 1,000 years, I know personally, I'm not going to be buying everything the CDC says hook, line, and sinker. How long will it take for that trust to kind of be rebuilt between the CDC and the American people?
Rebuilding trust once it's lost is really challenging. I think it will be very difficult to rewrite and change how people feel, how many people feel about COVID. But it's not too late in terms of monkeypox, in terms of polio, in terms of whatever crisis comes next. And it's going to take deliberate, direct communication with the American public. One of the challenges during a public health crisis is early on, what you don't know far exceeds what you do. And so you make decisions based on the best information that you have. And as that changes, you're going to change the guidance.
Yeah.
If you're not in daily communication with the public, it seems like every time you make a change, it's a flip-flop rather than learning as you go. And there's a real difference there, but it requires that trust to be in place for people to change what they do and recognize it as learning rather than seesaw kind of action.
Yeah, makes sense. Dr. Besser, great having you back on. Look forward to doing it again soon. Thank you.
My pleasure. Thank you.
All right.